Okay. Since we figured out what the hip was doing with flexion and extension a little while ago, how about lateral rotation? Lateral rotation is a pretty important movement of the hip. You do it in locomotion or not, whether you know it or not. You use those lateral rotators to make you move, okay? And there are 4 really good ones back here. Actually, there are 5. 2 of them have the same name. Piriformis pulls the femur that way, laterally rotates it. Gemellus, obturator internus. Gemellus and quadratus femoris, okay? You could say 5 here, because in number there really would be 5. 1, 2, 3, 4, 5. But you can say 4 because 2 of them have the same name, gemelli. Gemellus superior and inferior, okay? All right, that's good. Slide number 8.
Dr. Green,
Yes, ma'am.
I said piriformis, gemellus, obturator internus, and what's the quadratus?
Huh?
The first one's quadratus femoris.
Yeah.
Piriformis, gemelli, superior and inferior, obturator internus, and quadratus femoris. Okay?
Thank you.
Good. All right, here we are. Trendelenburg sign. What you want to know is sides here. What side is the lesion going to be on?
The same side.
What foot is planted? What happens when somebody has Trendelenburg sign? If it's the right superior gluteal nerve, okay, because it's a superior gluteal nerve lesion, dysfunction of the superior gluteal nerve, okay? If it's the right side, then the left hip is going to fall, just like this, because this can't contract. This can't contract. And the body will be thrown over, the upper trunk will be thrown over to keep it from falling over to the left, okay? Conversely, if you have a left lesion, the right hip will fall when you put your left foot down and you throw your body over to the left, okay? Want to understand that. All right. Kendra taking pictures of these?
Something
Huh?
like that.
Is that
Yeah.
what you're doing?
Yeah.
Fine, fine and dandy. Everybody's gonna converge on Kendra, okay?
She's gonna send us that video. Yeah.
Sure, I will.
The next one is don't stick needles into the sciatic nerve. Big problem. The safest place to put it is up and lateral, and that basically corresponds to the same place where the gluteus medius muscle is. Okay? We got gluteus maximus here, but if you incise it, that's where the gluteus medius would be. So you stick the needle up high and lateral, where you would expect the gluteus medius to be. Okay? All right. Next one. Hamstring muscles. Hamstring muscles, to be a true hamstring muscle, you got to have a couple of things. Number one, you got to have a common origin. Okay? And you know what? That hamstring portion of the adductor magnus qualifies in that respect. It does come from here too. So the common origin of the hamstring muscle, big deal. Italicized, underline, exclamation point, asterisk. Okay, question mark. Everything else. Common origin, okay? And it needs to cross the knee to be a real hamstring. So the semitendinosus and the semimembranosus do that, and the long head, the biceps do that, okay? And they want to flex the knee and extend the hip, because they cross both the hip and the knee. Well, this little one down here doesn't qualify. That's the short head of the biceps, because it only crosses one joint. Also, it's innervated by the common perineal nerve. Technically, the hamstring portion of the adductor magnus doesn't qualify either, because it only crosses the hip joint. It's innervated by the right nerve, tibial nerve, but it doesn't cross the knee, okay? All right, so I think we're good on that. Okay, here we have the greater sciatic foramen here, okay? There's the sacrotuberous ligament there. Here's the sacrospinous ligament there, because this is the ischial tuberosity down here. This is the ischial spine there. This is the lesser sciatic foramen right here, okay? And we made a big deal, and we will in the future, a couple of slides, about the stuff that goes like this across here. Pudendal nerve, internal pudendal artery, nerve to the obturator internus, come out here and go in there, but there's something that comes out here and goes across there, and that's it. The obturator internus muscle comes out of there, having originated on the inside of the obturator foramen, and going over to the femur, okay? So the obturator internus comes out through the lesser sciatic foramen, okay? All right. Some people are writing. That's good. That's what you want to do. Believe me, you won't remember this just by looking at it. Okay. Next thing is, what's this thing called a supracondylar fracture? Well, a supracondylar fracture is a fracture of the femur up here, because the femoral condyles are going to be down here. Femur, medial femoral condyle, articulating with the medial tibial condyle, lateral femoral condyle, articulating with the lateral tibial condyle. Above them is supracondylar, and a supracondylar fracture is going to be bent back this way by the gastrocnemius muscles. Gastrocnemius muscles are going there and they're attaching it to the femur, okay? So if you get a break in the femur up there, they're going to pull it back like this. You're going to have sharp edges of bone that are going to tear in to the things that are going back there. And what you need to be aware of is which one is the deepest. And it indeed is the artery, okay? And we could back up and say, well, that makes sense because of the position of the femoral artery before it went through the hiatus and stuff, but I don't need to confuse you there. We can think about that if we want to get a little bit more advanced. But it's clear that the popliteal artery is the deepest, then the popliteal vein, then the tibial nerve, okay? So the artery is in a precarious position